Welcome in. You're listening to Medical Spa Insider, presented by the American Med Spa Association. We are happy to have you with us. This week, we talk to the names that are shaping the industry in a pair of interviews recorded live by AM Spa founder Alex Thiersch at the Medical Spa Show. First, a conversation with Galderma President and Head of United States Operations, Silvina Nordenstahl. And if you want to be the first to hear from the biggest names in the aesthetics industry, join AmSpa at americanmedspa.org/benefits.
All right, welcome everybody. Welcome back. We're here at MSS and very excited, fresh off the plane from like the tarmac right into the hot seat. Silvina Nordenstahl.
Exactly.
Got that right. Yes. Like the new, amazing, warm, loving thing at Galderma, who's running the world, and from what I can tell, is absolutely like been just a breath of fresh air from what I've heard. So congratulations.
Thank you so much.
And remind me, what's your current position at Galderma? Because I'll screw up the title.
I am president of the U.S. organization now, but I've been with the company for a long time.
For 20 years, right?
Yes.
And from Argentina, and you started you ran the Brazil operation?
Yes.
And where do you live now?
Now in Miami.
Miami, okay.
We are moving the headquarters to Miami.
Are you?
That's the reason why. Yes.
Okay. That's awesome. Tell me about, and first of all, when did this change take place? When did you become head of US?
I came to the US in 22. So in 22, I started in the US. Then I went back to Latin America, and then I came back a year ago.
So tell me, like, what do you think? Like, what are your thoughts? Like, this has been, it must be a whirlwind, but you must be, enjoying yourself. What's the lay of the land showing you about what Galderma and the United States aesthetics and the whole market?
The whole market aesthetics it's incredible now. When you look back, it's been 15 years. It's been 20 years with Galderma, but 15 years working in the aesthetic space for me.
Yeah.
And it's incredible now how you see this market grow, transform, evolve.
Yeah.
And when you look back, it's impressive when we're starting and where we are now. And when you look forward, all that is to come. No? So it's really a privilege to be in a segment in a market that like the one we are operating in.
It is. Well, what are you excited about for the future?
For sure, the science and the things that we are bringing to market, for sure. Galderma, the trends that we are seeing are really interesting, and also being in the front of them, no?
Yeah.
Like medication-driven weight loss is a trend that we saw it coming. We want to support those patients. We were the first company putting a study out there to support them through the treatment, through the journey.
Yeah.
Menopause is another. We see a group of patients that have specific needs, and we want to support them. We also were the first ones putting a study on how we can treat these patients, support them with Sculptra, with Restylane. So being at the front of the trends, it's really exciting, and really understanding what patients need. Because at the end, it's putting the patient in the center of everything we do. No? Mm-hmm. When we really understand where the value is and where the needs are, is when we are really adding value.
For sure. No, I totally agree. It's refreshing to hear, because you do hear a lot with, pharma gets kind of a bad rap sometimes. I think it's like all about, pharma and the bottom line, and it is all about patients in the end. So that's cool.
It's about that, and having the experience of working in different markets is always about patients.
Yeah. Has anything surprised you about kind of the U.S. market? I know it's not unfamiliar to you, but compared to where you were down in Brazil?
No, for sure the scale of the U.S.
Yeah.
Like for everyone here, it's normal, but I have the opportunity of working in different markets, and when you come to the U.S., everything has a different scale, and for sure whatever you do in the U.S. impacts everywhere else. So that is a privilege to be able to operate in this organization and to drive this business. For me, it's a really big opportunity. So having the experience of being U.S., then being Brazil, then being responsible for the Latin American region, and now coming to the U.S. organization is seeing the impact that the U.S. can have on the overall.
Yeah, that's exciting. Is this your first time to Medical Spa Show?
No, last year I was here.
See, I feel like maybe we met last year. I feel like maybe we did. Did you have fun?
For sure. Always.
No, I mean, this is where like there's so many folks in this industry who just like, they love their patients, right? And it's really just, it's what it's about. And so it's about everyone just celebrating the industry, but at the same time, it's like, we've got to make sure that people are doing things safely.
100%.
And that's, on my mind constantly with this. It's the most important thing. And sometimes I think in this industry, there's a lot of folks doing things fast and furious. And sometimes I'm like, you got to take a step back.
100%.
And I say that because your training program that you have is, and I'm not just saying this, like from what I hear from injectors, trainers who are part of GAIN, absolutely love the Galderma training. And kudos to the whole organization. What are your thoughts on that? How do you go about improving that even?
That's our big commitment. And because we know, and it comes with the same, we put the patient in everything in the center, and safety is first. And also we know that we provide a solution. We want to be an ultimate partner to everyone that we work with. And we provide a solution. We don't only provide products. Mm-hmm. And training is part of that solution. Mm-hmm. To have the best outcomes with our products. And just now we had the approval for Restylane Contour Temple. Yeah. And that comes with, for sure, a lot of training because safety is first and we want to bring that product successful to market and training is essential. So training is in the core of everything that we do.
That's exciting with the approval too. I saw that. That's what's the plan for that? I mean, I know besides just completely killing it.
It's just starting. It's one of the innovations, and I'm happy to say that one of the things that is really exciting is all the innovation that we will bring in the coming months to the market in the US. That's something that is super special for us and that we have been waiting and preparing for. So we cannot wait as a team, and the team is ready. We are so ready to bring it to market, so we cannot wait.
That's really cool. Is there anything else you can share that's about to be, or what?
We had Restylane Lift indicated for the chin that was approved. That one I can share. We have Restylane Contour indicated for the temple, and then we have new innovations coming for sure that we are working with FDA to get them approved.
That's so cool. And when you come on, and forgive me if this is, I don't know if this is a dumb question or I'm supposed to ask this, but when you come on and become head of the U.S. market, and that also includes Cetaphil, right?
And the therapeutic business. We have 4 business units in the U.S. Yes, it's a 4 business.
Do you say, okay, I want to accomplish X, Y, Z? Like, here's my goals. Like you set up. Is that something that you do? Do you like really say, I want to transform X, or I want to grow X? I mean, or is it more like you've got, the board tells you to do whatever you got to do? Like, how does that work?
No, you for sure have a budget that you need to tie it off, but the way to get there it's what you work with your team, no? So there are targets that for sure we have, but the way you build towards the targets are there. The culture you want to build is what you do, the impact you want to leave in the organization, the kind of team that you want to build and leave, like the high performance culture. We are a growth organization, so we need people that are connected to the growth mindset that we have. Those are things that you can really bring in. For sure, we have numbers, we have targets, and that is part of what we do. But the way to get there, it's something that you can impact. And also you can challenge that, no? You can understand with your team how you can go beyond.
Yeah. I mean, it's interesting and difficult to, at your level, to build and influence a high-performance team because you've got folks who are already highly motivated, right? They're ambitious. And you've got to get the most out of them. How do you do that?
It's about purpose, I believe. It's about having the right people with you. Yeah. And when you have the right team on, it's like...
How do you pick the right people?
It's part of the science, no? It's part of the magic. When you build a team, it's part of the magic. And it's the combination of the people that were there and they are exciting on what's coming, and the people that are new and are connected with the purpose. So I believe it has to do a lot with the purpose. It has to do a lot with the mindset and the culture. They need to be connected with that. If that is in place, then the plans can work. If that is not in place in somewhere, the equation is not going to work. Yeah. So you need to put the right people.
Yeah. That's true. No, it's true. And so if you're aligned on kind of what your purpose and if you have the same kind of vibe and
Yes.
and I think that obviously you have to have that.
Yes.
That's like table stakes.
If we are a growth organization, we need people that are connected with the growth, that want to grow, that are part of this, that want to bring successful innovation to market. Those are the kind of people that thrive in our organization. So we need those kind of people.
Yeah.
So
Looking back, let's say 15, 20 years, did you ever imagine you'd be where you are right now?
for sure not.
Really? What did you want to be when you grew up? When you were younger?
I wasn't sure. I could be an architect. Like I was between two, or economy, and I ended up working in business. So I ended up here by chance. I started my career in consumer goods.
Okay.
So Coca-Cola company, really far from where I am now. So
this is a consumer good.
So I then entered in this segment, and I love it, and that's the reason why I stayed.
How did you get into the segment? What was your first?
Because
entry?
of Cetaphil. That was the reason why I joined Galderma.
That's awesome.
And then when we were building the aesthetic business, I was responsible of building the aesthetic business in Brazil when we were from nothing to building the organization. So that was the reason why we started.
That's incredible. It's a cool story. It's a cool story. And so you've kind of worked your way up and never thought you'd be where you are now. So what's next then? Like what's the next step?
I don't know. I really don't know. For me now, right now, my next step is really bring the U.S. organization and grow with the team. We have really great things happening across all businesses. As we were discussing, we have 4 business units and we have great things happening across all businesses. 2026 for us it's a really big year, and we need to execute this successfully to enter in a new phase growth for us in the U.S. So that is what I'm really committed to, and really put our team in the right place to do that. So that is what I'm really committed on. Yeah. And I always do that. I do whatever I'm in to my best, and then what happens as a consequence of doing that, no?
Yeah, one would hope. Yes, I mean, I think for you, it absolutely works that way. For me, I'm not even sure. I try to do stuff, and God knows what happens. We'll see. Well, I mean, it was a pleasure. I'm so glad that you came by, and I'm sure you're going to be able to do whatever you set your mind out to. I might get rid of that guy. Sorry. That's not. No one even knows we're on camera. No one can see. But yeah, I mean, so we'll obviously you're going to be around for the next couple days.
Yes.
Okay. Awesome. And any parting words for the folks that are listening? Last words of advice?
No, to stay connected, because many things have happened from our side, and you can count with us. Our commitment is to work with all of you to provide you the best service, the best training, and the best products. And that's what we are doing, and that's what we are committed to bring the best science to support your patients in the best possible way. That's the reason why we exist as an organization, and that's what we are here to do.
That's awesome.
As a team.
Thank you so much for your time. I know you're busy.
Thank you.
You just got here.
Thank you so much.
But we appreciate your time. Thank you.
Thank you so much for the opportunity. Thank you.
Next, Alex welcomes the CEO of Benev, Ethan Min, to talk about his strategy for bringing Korean innovations to the American market.
Welcome back to the podcast. Ethan Min.
Very nice to meet
Benev.
you. Yes.
I mean, I gotta tell you, it's great to meet you. CEO of Benev, I should say.
Yes.
Appreciate you taking the time out of God knows what kind of a schedule you have to come here to MSS, visit with us. How's it been? How's everything been? What do you?
Yeah, it's been great. It's been great seeing how this whole organizations with MSPA grew, meeting the needs of many of providers that are out there, and then create some level of community where we felt like we need to be a part of. So I'm glad that actually we were invited and be a part of what you guys are doing here.
Yeah.
And then I'm just here to, do what I do best, engage, connect with the people across the industry colleague as well as our healthcare providers. And it's hard for me to just walk the whole way without stopping because everyone's here. So this is great. So thank you so much for the opportunity.
Oh no, of course. Yeah. I'd love to go back a little bit and just kind of, because obviously your journey has been, everyone has a unique journey. But from where you've come from over the past 10 years, I'd love to talk about, how you got to where you are, and how the company has gotten to where it is, where it's now in the United States, where it hasn't been. Just kind of going back in time and talking about that evolution and how you've gotten there, and what that's been like, and what led to it. Why did you ultimately say, okay, U.S. is where we want to go, and here's how we're going to do it?
Yeah, so I stepped into the industry about 22 years ago, I would say.
Yeah, that's a long time.
Yeah, we were representing plastic surgeons for product like breast implants. We were representing Allergan from U.S. to Korea. Yep. And then my uncle had a business where representing different Europeans or American-made aesthetic product. That was a birth of aesthetics, right?
Yeah.
Plastic was aesthetic back then, right?
Yeah, for sure.
So that was the beginning of my journey. And then soon after, I joined Benev as a manufacturer because my uncle decided to build the manufacturing facility here in U.S. and he was doing business in Japan and Korea. So that's why I stepped in. So he was caught up with ideas of manufacturing something and made in USA. That was everything back then.
Really?
Right?
Yeah.
Made in USA, aesthetic, US dominated aesthetic field, period. That was my journey started with. And then I basically started as a manufacturer, as a skincare and then drugs, topical drugs for the dermatologists and plastics. Then market changes. And about 10 years ago, I basically realized that my talents and then where we are as a Benev was hitting a wall, right? Because we're trying so hard to be a manufacturer, but again, without proper resources and investment, it's very difficult to continue to do so. And then we saw the changes in Asia and in Europe as far as how these foreign manufacturers and products are so much innovative in a sense that they are fast. And they are implementing their product into the market faster than we ever thought in US. And then we couldn't keep up with.
100%.
So I decided to change my model to a distribution platform where we're dealing with medical aesthetic product that are being manufactured elsewhere that are not introduced in US market and introducing to US market.
That's a fairly big move. Investment, gamble, risk, but...
And said, you're right. So we decide to get the investment before it was solely owned by uncle and myself. And then he exited out with the model. And then I decided to stay with the investment that came in. And so that's the strong shift that we made to start representing a product like exosomes. We've actually prepared and launched 9 years ago. You would think that 9 years ago, people didn't know about exosomes. Right? We were the one of the first.
I mean, it seems like in the United States, it's all brand new to us.
Try to get into the basics of philosophy that I had because I learned the manufacturing before. I learned from big corporate where if it wasn't for them, I wouldn't be here to begin with, right? I learned how Allergan started the industry in many different perspectives and how they've done it. So there are things that I learned from them, but also I could be more disruptive and more fast-moving and with a less weight on the shoulder. So that was the model that I have to basically launch this product into the US markets. We're still...
That's interesting.
Philosophy behind it, it has to be science-based. Exosome, we spend a lot of investment on the study side of it and the clinical development, and then also working with the manufacturers to establish, robust, very good CGMP facility to support the quality of it. Because US still need that, right? You can't just be in and out and hit and run when it comes to US market because people are very sophisticated. People are looking for real science. So that was the big part of gamble that I had, partnering with the manufacturer who I don't own. Can they really be trusted and then follow my lead, right? Bringing product into the US market. And that gamble worked because a lot of companies that are out there were trying to come to the US market, but they couldn't figure it out.
Right.
But with me being here in US, knowing...
It didn't happen overnight, right?
No. So that shift happened 10 years ago, and then we've launched Exosome, we've launched Silvina X RF microneedling device, and then we've launched Viviscal Pro in US market. Back then it was Ireland, and then they moved to the US company. Obviously, Church and Dwight acquired them, so we then separated now. But and also I've launched the TiVo, obviously, about a year ago. And that's also part of the journey that I had with the vision that I had at the very beginning. And I wanted to get into the injectable And that was like 7 year me working very hard behind the scene, dreaming, and we were able to do that finally.
Now, did you always want to get in the injectable space?
Yes.
Was that kind of like really?
Because
that's a huge barrier to jump into. I mean, not maybe so much anymore, but at the time.
I had to prove myself that my model works with these Korean manufacturers, because Hugel is the manufacturer of Lativo. They're number one aesthetic company in Korea. So for them to choose me and partner with me, I had to be ready to convince them that it's worthwhile for them to partner with Benev.
How did you do that?
I think that the model that I established with exosomes and the other portfolio that we had sort of showed them a confidence that if it was given to the hand of Ethan, number one, he's not going to mess up because we're all about regulatory, we're all about compliance. Number two, that with the relationship and network we have in the US, that we had strong 5,000 customer base, we can get into it and then able to spread safely. Obviously, toxin launch has been very difficult for many companies. That I think that convinced them, right? And now we're partnering together because I need their muscle to help me expand more. So we are now looking at more stronger partnership moving forward for U.S. market. And like I said, my biggest gamble has been trusting our manufacturer to do the right thing for U.S. market. And it's like my mom used to tell me, Ethan, I trust you. And I'll do a little thing here and there, may not be worthy of her trust, but I always go back to her trust and try to get it right. And I see that constantly with our manufacturing partnership, that once you trust them, they will step it up. And then they will try to support me in a way that could be
and even if things
meaningful.
aren't perfect, they'll make amends and try to fix it.
So the key for the success, not only my visions, but my U.S. network, but it's also partnership with the manufacturers.
No, I mean, it's crucial because you do, even regardless of the fact that you're manufacturing in, overseas, and so you don't have to necessarily worry about that part, you still have regulatory hurdles in the United States. And those are no small things. So you have to get past those to get them in, even through distribution. So, I mean, I was just talking to somebody about the regulatory process. It's brutal.
But this is the place people come in and learn. This is amazing.
I know, it is. So actually, I would love for you to tell me about that because now you're coming at it from a different perspective because you're manufacturing outside of the U.S. and bringing it in. We've talked to some people who are just like, oh man, FDA, the manufacturing regulatory process in the United States is so hard. You even said yourself it was difficult. What makes it, why would you say that this is where people come to what makes it desirable then? You know what I mean?
I actually have maybe, some people may not like this, but I have a lot of respect for U.S. regulatory system. In a sense, where yes, it's.
Well, I mean,
protects.
It makes sense.
Protects the product quality, protects our provider in many aspects. But yes, I know it takes a long time, and it's
still the biggest market too.
Biggest challenge, but makes us as a manufacturer work harder to make sure, right, that we look at different angle and validate that. Because biggest problem that I run into right now is not about finding innovative product. It's about finding a innovative yet something you can validate, right? That are coming from Korea. You see many Korean companies come with innovations, but I only choose the one that I know for sure that I can validate their science and technology, and then something can be validated in US, right, with the proper compliance and regulatory channel. A lot of product that out there, they don't even they don't even care about how this could be utilized. They don't care about the regulatory environments. They said, oh, this is done in Korea, so you can do it in US. No, right? Everything has to be validated, right? And then product works how? Can you really validate your study and science behind it? Many of them don't have that, right? So I think what allowed me to play along and do what I do is because our focus on that aspect, the validating the regulatory aspects, find a way to be in compliance, which we do it differently than all the other players that are out there, because we still compete with the Korean company coming in. I represent products, a lot of products that are coming from Korea. But it kind of allowed me to, with our knowledge, with our approach, right, to separate it from all the others.
Yes.
Validating the Korean aesthetic is the key for our success as well too.
Yeah.
So I do have a lot of respect, but at the same time, I know the struggles that we all go through, right? Which is challenging. We are in RRBs and all the studies like for 6-7 years, and then again, we don't have any progressions, right? Like it's just been waiting.
Yeah.
So frustrating,
Yes.
right?
But when you get it.
Yeah, when you get it, like Lativo, it was a long year process, right?
Yep.
Hugel did a fundamental job handling this whole challenge with FDA. They made a huge investment, right, to really meet up with FDA's requirements. So now we have a quality product that we know we can go out and market. Says we've gone through 1,200 subject clinical trials, right, for glabella line indication.
Yep.
And it's gone through every possible way. So we feel very confident, interesting product to the U.S. market and providers.
Yeah.
If it wasn't for FDA,
Well, no, it's a fair point. I mean, it creates for those who are willing to make the investment and who can't. It creates a barrier of entry that not only is a barrier to entry, but it makes products safe.
Yes.
And it really it validates them.
I mean, like I said, some people may not want to hear what I just said, but
it's the facts.
Yeah, I think it is very critical. Yeah, especially with the world of exosomes.
Yeah.
Where
are we going with that? Like, what's next?
That? It's as long as industry plays right within the playground, with the place where you can still fall and then pick up and play again. That's great. But I've been challenging and encouraging our industry colleagues to do the basic thing right. Like, we're not talking about innovation. We're talking about getting your ingredient registered. Hello? Like, it's a cosmetic, right? FDA are not going to see that as a drug, period. Now, and there's other side of the angle where they said, well, exosomes are not allowed anyway, but that's not true, because statement saying FDA is not approved exosome is a true statement, but FDA do not approve cosmetic, period.
Right.
FDA have a different set of rule and guideline for cosmetic.
So if it's a cosmetic,
it's a cosmetic.
You're falling outside.
Then if it's a cosmetic, you have to follow cosmetic guideline.
Right.
That you have to list the ingredient properly. You have to make sure you say the things are not that are listed as a cosmetic claim, which is not easy, right? Yeah. But as long as you play along, right, with that borderline, I think there's a bright future. Continue to grow, and then some players now coming out within that disciplinary approach. I think that's very critical. They're still out there, still little companies out there pushing the envelope with old therapeutic. I don't judge them. I think there's probably future with that. So, but at the same time, it comes with a lot of responsibility. It comes with a lot of consequences, right?
Yeah.
If you gonna go Wild West route.
Yeah.
Yeah.
No, that's true. Wow, I got to tell you, it's a fascinating story.
Yeah.
You've got some. You said it was your uncle who
founded Benev.
Who founded
Benev,
it?
yeah.
And he always had this dream to do U.S. manufacturing.
Yeah.
And you've taken that and you've tweaked it, but you've made it possible.
Yes. Yeah.
That's crazy. That's really cool.
Yeah.
That's awesome.
And then it's actually his vision that I bought into when I joined, and then and then I've been just continuing it. And I don't think I've changed a lot, because the model they have done in Asia, which was very successful as a distribution platform, I basically told him, you are better off with what you have established. And then he was trying to do the manufacturing, but he already have a successful business model as a distribution platform, bringing U.S. product to Asia, spreading into the many Asian country. What I did is bringing these Asian products or European product into U.S. market and then spreading here.
And forgive me, I don't know. Is he still around?
No, he's retired, but he's still around. But I see him once in a while. Yeah.
What is he thinking about?
No, he's very happy with what's happening right now.
I mean, it's maybe a different approach.
Yeah,
but
and then
goodness.
He's happy with, because I was able to get him exited out with investment. Now I have to deal with all these investors, which is in itself is a challenge, but it's fun. Different set of.
You find that fun, huh?
Well, let me take it back. Maybe not fun, but it's a step in the right direction, and then there's no way around. That I could do what I could do now without. Right, so it's critical decision that I made to make that shift. We're doing toxin right now. If it wasn't for my investor, I would not even dream of what I'm doing right now with toxin.
True. Well, I would love. I mean, I could talk to you all day about this. I've got so many other questions.
Yeah.
It's fascinating, and congratulations.
Thank you so much.
I appreciate you coming in here to MSS and sharing with us. I think that's really cool. I'd love to talk to you more about this.
Of course.
So we'll have to set up a time to kind of dig into it. But just as we wrap up, I mean, what's next for you? Like, what's the next step in this journey?
So because our model is distribution platform, right? So we are now focusing on establishing technology and product portfolio that we introduced in the US market.
Yep.
So we just launched Galderma, which is another RF, monopolar RF device. There's a new trend happening right now. It's coming from Asia, obviously. And then we're looking into different injectables. We're going to focus more on the regenerative side of it. Works in a way, but regulatory, as you probably imagine, it takes time for me to register products. But there's some innovations that are coming in on the regenerative side. And also I'm in particular looking to have maybe next 3 to 5 years to launch a injectable products that are coming from Korea that are more regenerative aspect, right?
Yeah.
So it's not here yet, obviously, in US, because there are biostimulators that out there that are somewhat regenerative. I think that's very good. There's a whole movement now is happening in Korea with collagen back again. Like you're stimulating collagen, but why not injecting collagen? There are many sources of collagens, right? Like the human-derived from cadaver or animal-derived, or synthetic or a recombinant version of it. So that's the new movement happening in Asia, right? And the regulatory is usually fast, so people are already injecting, and then it's already seeing the outcome out of it. So I am also preparing to bring that level of or that kind of technology in the U.S. market.
That's exciting. Small ambitions.
Just a little tiny small ambitions.
Well, that's cool. Ethan, I appreciate you coming by.
So much.
It's really cool to hear this. I'd love to have you back, and we'll talk further.
Thank you.
Thank you so much. I appreciate that.
All right. Thank you so much.
You're welcome.
Thank you to our producer, Madeline Moeller, marketing content coordinator, who organizes the podcast schedule and guests and provides topics and talking points. Audio and video editing, voiceover, graphics, and platform management is provided by myself, Derek Hawk, digital marketing supervisor. Our themes are provided by Maka Music. Thank you for watching or listening to the Medical Spa Insider podcast. Please follow or subscribe wherever you listen to your podcast, and subscribe to our YouTube channel for future episodes. Ratings and reviews are greatly appreciated. For more information about the American Med Spa Association, visit americanmedspa.org. Reference to any specific product or entity does not constitute an endorsement or recommendation by AmSpa. The views expressed by guests are their own, and their appearance in the program does not imply an endorsement of them or any entity that they represent. AmSpa provides this podcast as a full service for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Please consult with an attorney on your legal issues. And as always, thank you for listening to the Medical Spa Insider. Remember, compliance is cool.